Right, good. Very good morning to you all, and thank you very much indeed for coming and your interest in the ICO. I too would like to echo Nicola's thoughts, really, and thank Dr. Grover very much for asking us to come and talk to you all here in this lovely town of Calcutta. I'm nothing like as experienced as my prestigious colleague Nicola, who's been doing this job for a long time. I've been doing it for about 18 months now, having taken over from my very famous predecessor, David Taylor, who took over from another very famous person, Peter Watson. So the exam's been going on for quite a long time now, with very important people in charge. And now you've got me, so I'm sorry about that. But I am going to talk about the exams, which I think are really quite important to you. And Nicola, after me, is going to talk about the fellowships, which are also an important part of the ICO function. So let me just give you a little talk about what the ICO is first. It basically represents professionals and professional associations throughout the world, and it has a World Alliance for Sight, working towards enhancing education, ophthalmic education and eye care, and it's a not-for-profit organisation based in Switzerland, and it's really the only association which produces international standards for education in ophthalmology. And it has a large membership of 96 national societies and 37 international subspecialty societies, as well as the supranational organizations that you can see there, including the AIOS, and also collaborating organizations such as World Health Organization, the International Association for Prevention of Blindness, and many non-governmental organizations. It's got several programs. We have put, I'm slightly biased, of course, and I've put examinations right at the top there, but around the clock, the fellowships, research, e-learning, standard setting, guidelines, and education. So there's quite a lot of stuff going on in the ICO. It has several initiatives as well, and I won't go into these particularly, but as you can see, there are quite a lot of things going on that the ICO does. But it's very interesting that when we represent the ICO at conferences around the world, what most people who visit our stand and our booth want to know is about the exams and about fellowships. So that's really what I'm going to be concentrating on today. As Dr. Grover says, we also host the World Ophthalmology Congress, and there was a successful meeting in Guadalajara in Mexico a month ago, and in 2 years from now, it's a 2-yearly event. It will be in Barcelona, so hopefully it'll attract quite a lot of people for that. So let's just now concentrate on exams. It's the only worldwide medical specialty examination. There's no other specialty that does this. And as you can see, since it was inaugurated by Peter Watson in 1994, we've had at least, and that's probably a pretty conservative estimate, of 25,000 candidates in over 80 countries. So it's getting very popular. The first two exams that were introduced in 1994 were basic science and theoretical optics and refraction. 3 years later, clinical sciences was added. David Taylor, my predecessor, added the advanced exam in 2010, and the foundation assessments were introduced 2 years ago. So we are expanding our repertoire. 137 examination centres in 80 countries. And anybody who is a coordinator in the audience, including Dr. Grover, we are extraordinarily grateful for your help, because without you, we cannot run these exams. These are the numbers in the last 5 years, and you can see there has been a huge increase in numbers. And Nicola's given you the figures for the 2016 standard exam. and it's very gratifying to see the numbers are getting bigger and bigger and bigger. For your interest, in India, a large number of you take these exams based in 12 centres across the country. And I would guess the 2016 figures are going to reflect these increases. The exam is based on the ICO residency curriculum. And that's a pretty good basis to start your revision if you want to take our exams. It offers an international consensus on what residents in eyes should be taught, and provides a standardized content. And we try, it is difficult, but we try and use to set the curriculum regardless of nationality, culture, or socio-economic status. And that's quite a difficult thing because ophthalmology is very different around the various countries in the world. And people who write the exams, and I'm grateful to those people as well, we all use the ICO residency curriculum to set the questions. So it's a useful thing to download from the ICO website, so you know what to expect when you take our exams. I make no excuses for basing our exams on UK exams. So I used to be the Director for Examinations for the Royal College of Ophthalmologists. So we are very proud of our reputation in the UK of setting exams, and I know a lot of you do the FRCS Glasgow and FRCS Edinburgh. And all these examinations are very rigorous, and we're very keen to keep the standard up. And you will therefore see that we have several educationalists working with us, and an extremely good examinations team with an international membership of the Executive Committee and the Standard Setting Committee. And we pride ourselves in writing appropriate questions for the country. All the questions are criterion referenced, and let me just explain what that is. Basically what we do is to set the pass rate of the exam before you sit it. In other words, so we don't actually have a set pass mark. We look at every question that you're going to be asked, and as a panel, we sit around and we imagine ourselves, which is really very difficult, imagine ourselves to be assessing the question as a minimally competent candidate. In other words, we're not bright for high-flying ophthalmologists. We're rather stupid people who would just about manage to pass the exam. And that actually is quite difficult, but we do that, and obviously the larger the number of people sitting around that table, the more accurate that standard setting is. So we try and get at least 20 people around that table, and we therefore then set a pass mark. And in fact, you see, if we set too difficult an exam, it is possible that nobody will pass it. And on the contrary, if we set too easy an exam, everybody will pass it, and which is quite good. But in fact, it's most of the time, well, pretty well every time we've done this, and we've done this now for about a couple of years, it's about a 50% pass rate in most of the exams, which is a reasonably good criteria of reliability. So the examinations that I want to talk about more in detail, there are really three of them. The standard examination, the basic examination, is the first one you take, between about 2 to 4 years of ophthalmology training. And that's divided up into three, as I'm sure you know, in basic science, theoretical optics, and clinical sciences. In year 4 onwards, you're entitled to do the advanced exam, having passed the standard exam. And as I say, I'm going to talk about these in detail a bit later on. In addition, there is a foundation assessment now over the last 2 years, which is an online preparation for the standard examination. How much is it going to cost you? It's always the comments that we are asked on the stand. It's set in Swiss francs because it's a Swiss company, and I'm sorry about that, but Swiss francs equals about one Swiss franc is about $1. It's really, the standard exam is set in 4 tiers, and it's based on the gross national income per capita. In other words, the basic bog standard wage that somebody earns in that particular country. But there are discounts for group bookings and bursaries that are online. We take online credit and debit card payments, which are paid directly into the ICO account. The basic science exam, just for your interest, in India is about $400, 400 Swiss francs. Expensive, yes, I'm afraid, but we try and offer good value for money. I'm very keen, to be honest, to try and reduce the fees for India because I think that will encourage a lot more people, and we're very keen to have many more people. We don't want to make a profit with this sort of examination. We wanted to get this out to as many people as we possibly can. So I'm fighting a bit of a battle at the moment with the ICO and the powers to try and reduce the fees for India, but watch this space. So why should you take the ICO exam? I mean, there's lots of exams out there. You do a lot of exams. And why should you really bother with the ICO? Well, several reasons in my view. I think it does provide international recognition. But remember, it's purely a theory-based exam, so it's not a license to practice. But you can compare your own standards against those people around the world. And I think, and I would say this, wouldn't I, it is the highest standard than other comparable exams. It also, with the advanced exam, it can grant you a FICO, and I'll tell you how to do that in a minute, which is more letters after your name, which means more money, looks good on the portfolio, and there are advantages for that. And there is reciprocity, certainly with the Royal College of Physicians and Surgeons in Glasgow, and with the Royal College of Surgeons in Edinburgh, we are just about to finalise the reciprocity arrangements there. So that means if you take the first part of the ICO exams, you're then entitled to enter the final part of the College of Surgeons of Glasgow and Edinburgh. So that's quite a useful thing. And finally, the other great advantage, and a lot of people would use these, is to gain fellowship points to gain a fellowship in other parts of the world. And Nicola will talk about that at the end of this lecture. Okay, basic science. These are tough exams. It's a 2-hour paper, 80 questions, single best answer, multiple choice, with 4 options, which is a standard format now for most medical exams around the world. Theoretical optics is a 1-hour paper, 40 questions of single best answers. And clinical science is 200 questions, a 4-hour paper of single best answer. And there are some people who will take the whole lot in one sitting. So in other words, 6 hours of exams. We don't advise that, because that's a lot of, that's really hard. And coming out of the end of that, you will feel very, very tired. Quite a lot of people just do the standard, basic science and optics in one sitting, which is a 3-hour stint. But I think doing the clinical science on top is really pretty tough, actually. We run the exam in 5 languages. English is obviously the most popular, but it is translated into Chinese, French, Portuguese, and Spanish. We do have problems with translations, and we try and limit the number of languages that we translate into. Chinese especially is very difficult to translate, and very interestingly, most people who take the exam in a foreign language also have the English paper open as well, so they cross-reference, which is interesting. And Spanish especially, again, it's difficult because there is Spanish and Spanish South American, and that is very much like English and American. In fact, actually, the 2 languages are the same, but they're very, very different. So it is quite complex getting that right. But you guys will take it in English anyway. Okay, all single best answer, multiple choice questions, and I won't teach my grandmother to suck eggs. You've done MCQs since you were 3 years old, I guess. But a multiple choice question consists of a problem known as the stem and a list of suggested solutions known as options. And the options consist, certainly in our exam, of 1 correct or best alternative, but which is the answer, and 3 incorrect or less likely options, known as distractors. So in other words, all 4 of these options may be correct, but 1 is usually the most likely. And I couldn't resist Homer Simpson, who has his distractions. So let's give you some work to do. It's early in the morning. I'm sure you're feeling fresh and ready to do some exam questions. This is a relatively straightforward clinical question. A 30-year-old male alcoholic has a broken bottle thrust into his face, cutting the left cheek, forehead and upper lid. The eye seems untouched. When he comes to the A&E department, which one of the following is the most important next step? So that's the format we tend to use. Which is the most likely? All of these options are you could do. But which one would you do first? Any guesses? A, B, C, or D? Okay, this is another pretty basic stuff. This is the figure corresponds to a 12-year-old boy with hepatolenticular disease. Now that's actually a pretty easy question. I should have said really this is a 12-year-old boy with a little bit of a shake, and you just make it a little bit more difficult, a bit of extrapyramidal symptoms. And then a funny brown line is found rather than copper deposits are found in which layer. So if you've got Bowman's layer, Descemet's membrane, anterior stroma, or the endothelium. Oh, you guys are too good, aren't we? Well done. Well done. Very good. Perhaps a bit more difficult. Images are really important, and we really do make sure that the images that you get in your written exams, on your paper, are as crisp and as clean as possible. You can take as many photographs as you want with this, but they won't be in the exam. So we do try and get these images right, and sometimes it is difficult. And there was one problem last time in the advanced exam. There wasn't a very good picture, but nonetheless, we try our best. So this is two pictures of an optic disc, 6 months after each other. And which one of the following statements about the optic disc is most likely to be true? So apoptosis. Programmed cell death is the final result of damage in this case. Figure B, there's focal thinning of the neuroretinal rim. Figure B, there is peripapillary pigment hypertrophy. And D, the intraocular pressure in the eye fundus of figure A is normal. So what do you think for that one? Hands up A. Hands up B. Hands up C. Hands up D. So it's a difficult question. Well, you don't know if that pressure is normal. You don't know. You've no idea whether that pressure is normal or not. We feel that the right answer is apoptosis. Okay, so well done over there. Good. That's quite a tough question, and it needs a lot of thinking about. And we do when we discuss this paper, the exams, we argue all the time, as you can imagine. There's about 12. No, there's more than that. There's about 25. Eminent ophthalmologists sitting around the room, and there's a lot of arguments and discussions about these questions, and we try our best to get the right answer. And most of the time we get it right, but there are problems sometimes, and we don't. And it's very interesting. Sometimes there's a spelling mistake, and you look at these questions time after time after time, and you always find at least one thing that you've missed, and we feel bad about it. But I don't think there's human. We're not robots. Okay, another nice one that you remember for the exams. Figure below corresponds to a patient with an acute anisocoria, anatosis. And you can see that ptosis on the left-hand side there, and the right pupil is slightly larger than the left. And then we talk about lovely pharmacological tests, installation of hydroxyamphetamine hydrobromide, results in dilation, and cocaine dilates the left eye. So I think you agree this is a Horner syndrome. So which is the best part of the anatomy to evaluate? Brainstem, cavernous sinus, chest, or orbit? Thank you. Well done. Good. You're on the ball today, Mike. Good man. Good girl. Now this will get you going. This is an optics and refraction question, and I'm sure all of you will know the answer to this. This is very easy. So the figure below represents a confocal scanning laser ophthalmoscope. Which one of the following statements is most likely to be true? And I'll let you read that, because I don't know the answer to this at all, I'm afraid. I rely on my optical colleagues. Mr. Singh in the front row, I'm sure, will be able to give us the answer. And the answer, just for your information and education, is C is correct. So some of them are dead easy, some of them are really quite tough. And even the senior examiner doesn't know the answer to everything. So that's the standard exam. The advanced exam is a step higher than the standard exam, and it's done after 4 years of training. It was designed for trainees in the fourth year and over year of training. 85 questions, 3-hour paper. 10 questions are extended matching type questions, and we'll show you an example of that in a second. And the other 75 are standard single best answer ones, as we've just looked at, but perhaps the slightly harder ones. Now, the advanced exam has an advantage of once you've passed a local face-to-face examination, in other words, a clinical exam, in addition to the advanced exam, or you've got a license to practice independently from your Ministry of Health or association, then you can use the acronym, post-nominal acronym FICO, which obviously is good and it looks great on your brass plate outside your consulting rooms, and you can charge an absolute fortune for it. So that is an advantage for taking the advanced exam. Let's give you an example of an extended matching question. Now, these are really, really difficult. I think you've got to read the question a lot. And remember, there are 10 of these. So in the clinical history below, some words or parts of sentences A, B, and C or D are missing. In the table below, match the missing words or sentences with the most appropriate word, phrase, or short sentence in the column 1, 2, or 3 below. We recommend that you read the question very carefully before answering. So, here we go. A male aged either 70, 30, or 10, sorry, I can't read on my screen, with a 2-year history of unilateral, bilateral, or bilateral asynchronous dryness, burning, and irritation, thought to be mucous membrane pemphigoid or ocular cicatricial pemphigoid. We try and get the meaning across in very different ways, because different places have different ways of expressing the particular disease. Confirmed by a positive response to steroids, conjunctival biopsy, or raised serum IgA. The patient also had urethritis, pulmonary TB, or rheumatoid arthritis for several years. Okay, so let's say a male aged how old? What for several years? Urethritis it is. So some of you get the FICO, but some of you don't. This is another advanced exam, which again is an advanced question, which is based on rural Asian problems. So this lady lives in a rural village. She had a sore, irritable eye for many months, and relatives had tried to remove lashes with forceps bought at a local market. So regarding this lady, which one of the following statements is most likely to be true? We always end in that sort of way. So you can see she's got, well, probably chronic trachoma. So do you give them a single dose of azithromycin? Do you give them no medical treatment at all? And say, what do you think? A, B, C, D? Very good. Well done. Super. I'm glad you're all on the ball. That's great. Now, if you enroll for the standard examinations, then you will also get access to the foundation assessment, which was introduced a couple of years ago. It's an online assessment, and it is open access. And it allows you to prepare for the standard examinations and anything else you want to use it for too. And we feel it's a unique learning and assessment tool for ophthalmologists. It's all online, as I say. It basically covers all the 3 exams for the standard exam. So basic science, there's 50 questions. Optics and refraction, there are 20. And clinical sciences, there are 50. It allows you 20 minutes per question. It's open access, I've said, so you can keep your books open, and you can use iWiki or whatever you want to use. Interestingly, it has a confidence indicator, and I'll tell you what that means in a minute. You can also, it comes free with the standard exam, but you can actually buy it via the ICO website at a charge of $50 if you want to do it without going through the standard exam. So it's, as I say, it's really in conjunction with ICO exams. It's on your computer. It's blueprinted as all the exams are to the ICO curriculum. Open access, no monitoring. There are some security features, and you get instant results on completion, and you can download a certificate. So let me show you what it looks like. I think you can see that. So when you enroll for that, you have this screen appearing, and if you've enrolled for the basic standard examination, it gives you a voucher code, which you can then punch into any of those 3 assessments, and it gives you a whole load of questions. And you could, this is the next page really, so it gives you all the classifications, all the areas that we ask questions for, and it gives you an idea of what we do. Now, here's another question. This is probably a bit too small for you to see, but basically this is unilateral preceptal cellulitis, and there's 4 questions. 4 options, as you can see, and you can tick which one you think. But the other interesting thing is those three radio buttons down the bottom are confidence indicators, which ask you whether you're confident, very confident, or not confident. And you can tick those. Now, with the confidence indicators, you have to decide how sure you are that that answer is correct. And if you're really, really certain this answer is correct, it gives you 3 extra points. If you're incorrect, if you're really certain and you're incorrect, it takes 3 away. That's really mean. If you're reasonably certain, it gives you 2, or it takes 2 away. And if you're not certain, it gives you 1 extra point. But if you're incorrect, it doesn't take any away. Now, that's really tough, isn't it, guys? And you think, well, that's pretty mean, really. But the important thing is that the confidence indicator does not impact on your candidate's final score. So it tells you, it's useful for you to learn how confident you are, but it doesn't actually impact on your scores. The other good thing about this assessment is that candidates will receive feedback on each question along with the correct answer, and we will grade you from A star to D. And you can download a certificate. And if you wanted to, if you got a D and you wanted an A star, you can do it again, but you've got to pay another $50, I'm afraid, for that. But the other advantage of that is it's very, very useful for trainers who sometimes, there are some countries who use this as a indicator of how good their trainees are, how good their residents are, and that allows them, sometimes it allows them to progress to the next level. So there are some countries that are using it as almost a certification. Right. I can't read that on my screen here, but this is another question, basically, which it doesn't always have to have pictures, and this is one on acanthamoeba, and you notice on the left-hand side it gives you a feedback on the correct answer. Now, it portrays the results in graphical form, and it gives you on the right-hand side bar charts here. And you can see in this particular case, and in fact Miss Quilter did this exam, and you can see she's pretty ignorant because she got sections sections B, C, D, and E. She didn't get any right at all, but A, F, G, and H she did well to a certain extent. But she was very confident that she didn't know anything, or she did. She was supremely confident that she thought she knew it, but she knew absolutely nothing. And that, interestingly, is very much a male response rather than a female response. The boys think they know everything, but actually don't know very much. The girls, they know everything, but they don't think they know everything. So it's quite an interesting gender distinction. The results also are portrayed, interestingly, in this sort of cobwebby spider's web form, which is interesting. And you can see, really, the blue inner graph is the amount of information and knowledge that Nicola knows. And the yellow-orangey colour is the amount of confidence that she's got. So it's the same thing portrayed slightly more graphically. And ideally, what you like is the 2 circles are the same area. So you know what you know, and you're confident that you know it. So that's what you're aiming for, and you can do that again and again and again. So that's the foundation assessment. We think it's actually quite useful. The feedback that we've had from people that have done it already, they think it's really pretty good. So whenever you enroll for the standard exam, you get that free of charge. The next exciting thing that has just happened over the last 6 months is we've launched an ICO app, which is effectively the same thing as the foundation assessment. And it's downloadable free of charge on your mobile. These are some of the screenshots, and again, I apologize for the lack of quality of these screenshots, but you can also opt to have a time pressure, so you can be under the clock, or you don't have to, or you can use the confidence indicators or not. So you can do it very benignly, or you can do it with really good time pressures, and you can run it with your friends. You can run it on the bus, you can run it in the bath, and you can do it wherever you want, really. And it's the same thing, really, and it's free of charge. It's really much the same as the foundation. This is the same question that we saw for the advanced exam in app form, and again, it's pictures. We're trying to get some videos, although videos are quite difficult to get hold of. And you answer the questions in exactly the same way, and it gives you feedback. Download it, because it's jolly good. And since September, when it was launched, we have had about 2,000 downloads of it already, which is quite interesting. There you go, wiggle, wiggle, wiggle. There you are, QR codes if you want them. We've got them. If you visit the stand, the ICO stand, which is in the other side of the road, we will give you the QR codes and a very pretty bag to store all your bits and pieces in. Now, what's about the future? How are we doing for time? The future, we be running subspecialty examinations, and we're trying to go to online examinations. The ICO have just released 4 subspecialty curricula: cornea and external disease, glaucoma, neuro-ophthalmology, and ocular plastics. We are going to pilot cornea and external disease subspecialty exam in October in India and Pakistan only, in conjunction with the AIOS. 60 multiple choice questions, single best answers, online only, but in a single venue, and results will be audited. And that's the eligibility criteria. So this is going to be quite exciting, and it'll be interesting to see. It'll be interesting to see what the response will be. Finally, online exams. We're keen to get all our ICO exams online within 5 to 10 years. Single venue usually to start with an invigilator and coordinator, but eventually, hopefully, at home on your own laptop, importantly with security, and using what's called a virtual proctor who will be staring at you as you do your exam. So that'll be quite interesting. And there are such things out there, and it is possible to do. And that will be a lot easier, and that will save lots of huge, great paperwork and things like that. I'm going to finish there. Thank you very much for listening. Hope you've learnt a bit. I'm going to hand over to Nicola to talk about the ICO fellowships. Thanks very much.